Hello and welcome to HMIS Security Awareness Training. HMIS is the acronym for the Homeless Management Information System, which is a database you will now have access to in order to record and view data for the clients your agency serves. You are here because your position is to work in some capacity with individuals who are experiencing homelessness. Your contribution to HMIS is critical to your clients, agency, funders, and you. This training grants you access to HMIS and is designed to teach you the importance of protecting your client's privacy. You will be receiving a lot of information, so I encourage you to follow along and take notes. This presentation highlights the importance of exercising caution when you are using HMIS. The client information you will be exposed to should always be kept confidential. During this training, we will cover the data standards, basic requirements, user authentication and access, defining security, client confidentiality, and laws and regulations. The HMIS data standards are set forth by the U.S. Department of Housing and Urban Development, also known as HUD. The data standards ensure that every HMIS captures the necessary information to fulfill HUD reporting requirements while protecting the privacy and informational security of all individuals experiencing homelessness. When recording and entering data into HMIS, it is extremely important that you do your best to collect all of the required information to the best of your client's knowledge. If you have questions or need clarification when you are using HMIS, you are able to access the data standards, which can be accessed through the HMIS resources page. The work you do and the data you collect and enter HMIS is so important. This data affects our clients, agencies, and San Antonio as a whole. The time and attention you give to your data entry oftentimes results in more funding, which helps our clients, agencies, and community. As an HMIS user, you will need a unique username, which has already been set up for you, a unique password, and a signed electronic security awareness agreement, which you will complete once we finish this segment of the training. When you access HMIS, you are required to use a computer with antivirus software and an individual or network firewall in a secure network location. Do not access HMIS at any public, non-secure location. As previously mentioned, your username has been created for you, which will be your first and last name separated by a space between the two. A temporary password is currently set up for your initial login. Once we log into HMIS, you will be prompted to change your password, so keep these items in mind. Your password needs to be at least 6 characters long and include at least 1 lowercase letter, at least 1 uppercase letter, at least 1 number, and at least 1 special character. This is an example of a strong password and an example of a weak one. Another option is to create your password to be a catchphrase or sentence that includes the items listed. Every 90 days, you will be prompted to change your password. When doing so, remember to create a strong password. We want you to always have a strong password in order to protect your clients and you. In addition to your username, we have assigned you a role within HMIS. Your role is determined by your agency category, department, position, work assignments, and job duties. Your role determines the amount and type of information that you can access. It's important to be mindful of the client data you will have access to and to ensure that you are protecting it. So do not save your password to your browser. Keep your login information private. That includes not sharing your login information and not allowing anyone to enter or view client information under your credentials. You can only log into HMIS at one location at a time. Although HMIS is designed to automatically log you out after 30 minutes of inactivity, remember to always log out of the database when you are away from your computer. Remember that it is your responsibility to exercise good computer practices. If possible, lock doors when you are away from your office. Print documents to a printer in a secure location. Store client profiles according to your agency's policies and procedures, and be sure to dispose of any HMIS paper records properly. Your computer monitor should be placed away from others' view. Use a privacy screen if possible, and always lock screens when away. Pressing these two keys simultaneously will quickly lock your computer screen. Again, remember we are using these best practices so we are protecting our client's privacy. HMIS is a tool to record client information and share it among authorized HMIS users so we can best serve our clients. HMIS is used for the case management of our clients, which involves enrollments, completing assessments, referring clients, creating case notes, and coordinating services for clients. The data in HMIS is used for reports, funding, and research. You are able to see the importance of our data quality based on the funding granted and the results of conducted research. We use HMIS to monitor compliance for legal and auditing purposes. Lastly, HMIS is used for bed utilization to help agencies keep track of bed reservations and how many beds are available. HMIS should not be used for personal gain, biased opinions, stalking, curiosity, or sharing with others outside of service providers. All information you access should remain confidential. Security is the safekeeping of clients' personal protected information, which includes protected health information and personally identifiable information, and sensitive program information from unauthorized access, disclosure, use, or modification. As an individual user of HMIS, you are required to comply with federal, state, and local confidentiality laws and comply with limits to data collection. All data collection must be relevant, appropriate, and lawful. Each agency that uses HMIS is required to post signage at intake or a comparable location with general reasons for information collection and reference to privacy policy. Agencies may infer consent for uses in the posted sign and written privacy policy. Client information should only be searched and/or shared on a need-to-know basis. The need to know is a legitimate requirement of a person to access sensitive information that is critical to the performance of an authorized assigned mission in connection with services to a client. The need to know is a necessity for access to specific information required to carry out official duties. All users must be able to support access to client files. In order to help protect client privacy, the HMIS team monitors individual HMIS use for violations. Violations must be reported to your agency's security officer, the HMIS Security and Compliance Coordinator, and in some cases, to government agencies and the client. Violations may result up to termination of use rights, disciplinary action, and in extreme cases, prosecution. If violations occur, here are some civil and criminal penalties according to HIPAA, 42 CFR, and Texas MRPA. Consequences of violations could result in fines up to $250,000 and 10 years in prison. In order to help protect client privacy, as an HMIS user, we are responsible for adhering to the following laws: Federal Health Insurance Portability and Accountability Act of 1996, the Texas Medical Records Privacy Act of 2012, and 42 CFR Part 2, Confidentiality of Alcohol and Drug Abuse Patient Records. HIPAA is short for the Health Insurance Portability and Accountability Act of 1996. HIPAA sets the standard for protecting sensitive health data from being disclosed to unauthorized parties. There are 4 key aspects to HIPAA. First is privacy. Privacy are the standards to protect personal health-related information and patient rights. Second is security. Security requires specific physical, technical, and administrative safeguards prior to disclosure of information. Breach notification. The patient has a right to know when information is disclosed to an unauthorized party. Fourth, enforcement. There are financial and criminal penalties if you violate HIPAA rules. Within HIPAA, we have covered entities and business associates. Covered entities include certain healthcare providers, health plans, and healthcare clearinghouses. Examples of covered entities are hospitals and health clinics, physicians, health insurance companies, and mental health and substance abuse treatment programs. Business associates are any person or entity that performs an activity or function on behalf of a covered entity that involves protected health information or provides legal, accounting, management, administrative, financial, or other services for a covered entity that involves PHI. Haven for Hope is subject to HIPAA as a business associate of several covered entities. As an HMIS user, we all must safeguard every client's PHI, which is collected or created as a result of providing services to him or her. These rules apply to you when you view, use, and share PHI. PHI stands for Protected Health Information. PHI is information related to a patient's past, present, or future physical and/or mental health condition. It can be in any form, written, spoken, or electronic, and includes at least one of the 18 identifiers. This is a list of the 18 PHI identifiers. When submitting tickets to the HMIS ticketing system, it is important to omit any and all of the above PHIs. You should only include your client's initials and unique ID number in your ticket submission. When you are corresponding with authorized HMIS users through email or web-based tools, all PHI should also be omitted. Only use client ID and initials in correspondences. You may only use or disclose PHI as required for your job and for routine purposes, and you must use or disclose only the minimum information necessary. This rule applies to you when you view, use, and share PHI. PHI may be disclosed in the following instances: with written consent in accordance with the client's written authorization. If required by court order, you must obtain a copy of the court order in a medical emergency and to report abuse or neglect. In the case of reporting suspected abuse or neglect, it is important that you follow your agency's policies and procedures. Policies can vary, so make sure that you speak to your manager or supervisor so they can inform you of your agency's policy. Always reach out to your manager or supervisor and follow your agency's policies and procedures in order to ensure you remain in compliance with all of your standards. PHI may also be disclosed in the following instances: for a missing person, material witness, victim of a crime, or fugitive. In these cases, before disclosing any information, you must consult with your legal team, follow your agency's policies and procedures, and inform the HMIS Security and Compliance Coordinator, Nina Gall. PHI may also be disclosed in the following instances: to the client with appropriate documentation, to a legal representative. You must obtain a copy of the letter of representation and/or the appointment letter. For research, audit, or program evaluation, you must have a research agreement and complete the IRB process. Or to another healthcare provider for purposes of treatment, payment, or healthcare operations. Any other disclosure is considered non-routine and requires approval by your legal team and the HMIS Security and Compliance Coordinator or the HMIS Security Officer. If you are uncertain whether a disclosure is routine or non-routine, seek guidance. Remember to only use PHI as necessary to perform your job duties. Use and disclose the minimum necessary to perform those job duties. If you need to use or disclose PHI outside of routine uses and/or disclosures, consult the HMIS Security and Compliance Coordinator first. Users are responsible for ensuring confidentiality of information even after access to HMIS has ended. Here is the contact information for the individuals you will report suspected violations to. If you have any questions or need additional training, you may contact the HMIS Training Coordinator. This is a copy of the Security Awareness Agreement that you will be authorizing. This agreement is valid for 365 days and requires annual renewal. Before your agreement expires, you will receive email notifications at 30, 15, and 5 days. To ensure that you maintain your HMIS access, once you receive one of those emails, log into HMIS, view the Security Awareness presentation, and create a new agreement. This concludes your Security Awareness training. Thank you for your participation.